So my name is Jasper Brugts. I'm a cardiologist from the Erasmus Medical Centre in the Netherlands, and I presented today the subgroup analysis of the Monitor HF trial. Subgroup analyses are important to study because we can search for certain subgroups with a more or less clinical benefit from a certain technology, so you can tailor therapy towards the patient most likely to benefit. The Monitor HF trial was a randomised clinical trial in 348 patients that we selected upon chronic heart failure, NOA class 3 and one previous heart failure hospitalisation, and on GDMT. And those were randomised to standard of care or PA-guided therapy on top of standard of care. It was an open label design, and we had a follow-up of 1.8 years. Primary endpoint, quality of life. Secondary endpoint, cumulative heart failure hospitalizations during follow-up. So we studied predefined subgroup analysis of age, gender, ejection fraction, etiology, atrial fibrillation, diabetes and ICD therapy. And we had exploratory subgroups for obesity, renal function and NTproBNP levels. And we assessed all subgroups across various clinical relevant endpoints. So we assessed quality of life, heart failure hospitalizations, heart failure hospitalization and mortality, and even the effect on mean pulmonary artery pressure, to have a really clinically relevant overview of the effects of subgroups on all the assessed endpoints. So what we found is that there was an overall consistent treatment effect of PA-guided therapy in patients with chronic heart failure across all the predefined subgroups and the exploratory subgroups. And it was within the predefined endpoints, but also across the clinical endpoints. So the benefits were consistent across quality of life, heart failure, hospitalizations, and effects on mean pulmonary artery pressure. So these findings of the subgroup analysis add to the current data that we tested the consistency across predefined subgroups and exploratory subgroups within and across various clinically relevant endpoints. And we did not find any clinically relevant heterogeneity in the treatment effect, which is important, so we cannot find or identify a subgroup with more or less clinical benefit of PA monitoring. And the consistency within endpoints, but also across endpoints, is quite strong as we tested the whole spectrum of effects. And this can help in wider implementation of this technology. So the next steps are to study wider implementation of this technology in Europe, because it is not reimbursed at this moment. And I think more data will help to assess the level of overall evidence for this technology and wider implementation throughout Europe.